Cool.
I just put in this webinar is being recorded. Do you guys see that?
Mm-hmm.
Sweet.
Yes, it shows up.
Oh,
And the other thing a bunch of people said yesterday is if one more person talks about self-care, they're going to punch them in the face.
That is,
Like they're
that is
so
nice.
sick of hearing self-care.
yeah.
That is
Yeah.
my,
Without the meaning, maybe without, because I guess also it's maybe, you know, digging into what that self-care means and looks like too, because I think if someone says do self-care and then you're like, what does that mean? Or maybe it means something different for me.
Yeah.
Then
That's
it's
the
kind of
key,
meaning,
right?
yeah, because self-care for you might be like, I'm going to play video games for 4 hours, and like self-care for somebody else might be like, I'm doing yoga. Take it
Yeah.
back. It's all very soon.
And do you want us all on mute unless you ask a question?
Sure, yeah. But I might not remember to do that. So if you don't remember to do it, I don't think it's a big deal. If sometimes there's background noises, and that's okay. So in 1 minute, I'm going to start the webinar. We're going to give like just a few, I know, we're going to give a few minutes for people to button up, to just trickle in, because they will. I'm curious to see. It's always fun to see who shows up. This is the quiet, awkward part.
I'm in a competition coming up, but I try and not practice while I'm on this. I'm in a funniest person with a day job contest. I'll try and be good. Yeah.
Okay, it's 1 p.m. I'm going to start this for people so they don't get confused. I should start. So far, I see 3. Yeah, so we'll just let people, hi everyone, we're just gonna let you trickle in before we do intros or kick anything off. Get comfortable. If you're on your lunch, just enjoy, get a water. Just let folks come in. We also have a phone call listener, which I like to see. And let me just check our settings on this. Some folks are having trouble accessing, is what I'm told. So I'm just gonna make sure. We give some extra time for that. That would maybe make some sense as to why we're seeing lower numbers. There is a passcode. Just quickly ask an Inkblot staff. Oh, somebody's raising a hand. Ben. Oh no.
It looks like the Eventbrite page didn't have the link.
It does have a link when I look at it. It's in there. Okay, you have to scroll down. Okay. Okay, circuitous. Sorry for the flow, everyone. Huh. I am just going to give people 2 more minutes. I'm going to give people until 1:05 just because of this. And if anyone trickles in after that, that's totally fine. I'm curious. I guess putting the link at the bottom isn't the greatest. You're all muted. You're all muted. You're good. Yay. And if you're an employee who's at a workplace right now and you think someone might want to go to this and you think they might be struggling to find the link, go ahead and pop that link in your employee Slack, because I think that might be an issue here. I'm just gonna quickly send a little note to anyone who might have registered if they are having trouble about where that link is. But yeah, there we go. You know what? It's because people had to enter a passcode, I think. No passcode next time. You know what? Why don't I get people started talking and I can do some resolving as we get the chat started. So thanks everyone for attending today. I really appreciate you taking this time out of your day to talk about something that's really, really important, which is your mental health, your employees' mental health. You know, all of us, most of us here are working humans at some point in our lifetime. So this will be a question that comes up. So the theme of the webinar is breaking mental health stigma and building empathy in the workplace. While the pandemic has maybe, you know, highlighted some of the commonness of experiencing, we will receive, yes, you will, Mindy, you absolutely will. Has highlighted how many of us have actually been struggling with mental health concerns, whether openly or not. We know that about 1/3 of Canadians now are reporting burnout in the workplace, high levels of stress and anxiety. 1 in 4 Americans in a recent study have left the workplace due to mental health issues. And so, okay, thanks, Jessica, for explaining that. And so, you know, mental health is like a hot topic these days. It's affecting us all, but do we feel more comfortable about talking about it in the workplace, the place where we spend the majority of our days, that impacts our livelihood? And, you know, if not, what can we do about it? So I have some folks here today who have extensive experience talking about mental health in the workplace, both breaking stigma and supporting the mental health of employees. And they're gonna start this conversation today. So let's start maybe with Karma, who is my fellow Inkblot buddy. For context, I apologize, guys, I've been distracted by this event link issue. So I am Sarah Mortimer. I'm the marketing manager at Inkblot. Inkblot is an online therapy platform that also offers employee mental health benefits and many other health benefits. We're very invested in the health of the whole human and workforce. And Karma's on our team. Karma, I'll let you introduce yourself first.
Thanks, Sarah. So my name is Karma Stanley. I'm a registered practical nurse. And as Sarah said, I'm the team lead of our advisory services health coaching for Inkblot, where we really feel passionately about changing the landscape of EAP and what that looks like for individuals. Professionally, I've worked really across the continuum of care and Emerge and in community care and working with at-risk individuals. And I feel absolutely passionate about supporting leaders and health education and advancing mental health and mental wellness.
Amazing. And I think next, maybe we could hear from Hassel. I'd love if you could introduce yourself.
Sure. Thanks for having me. So my name is Hassel Aviles. I am the co-founder and executive director of Not 9 to 5. And Not 9 to 5 is a nonprofit global leader in mental health advocacy for the hospitality and food service sector. Although we are very niche in those industries, we really do have a community full of all types of frontline service workers, including retail, grocery, a lot of people that just resonate with the term Not 9 to 5, a lot of entrepreneurship, freelancers and such. And we really focus on practical education and community building, first and foremost. As well, I myself am someone who has always struggled with their mental health. And for most of my, I guess the first part of my life was very full of shame and stigma around that experience. But for the last 20 years, happy to report that I no longer really feel that way. I have absolutely no shame and stigma about living with mental illness or, any other form of mental health challenge. And I now talk about this every day. So, went from one extreme to the other of being very silent and now being very open. So really excited to be here. Thanks.
Whoops. Thank you, Hassel. And next we have Robyn Priest, who is just informed us they were in a competition about best, funniest person in the workplace. So maybe that'll give some context for how this could go. But could you introduce yourself, Robyn?
Hi, everyone. My name's Robyn Priest, and I'm the co-creator and what I call the chief non-conformist of Robyn Priest Live Your Truth. And basically that's an organization, everyone that works with us either has their own experience of a mental health issue or are a family member. All our programs are designed by people with their own experience. And basically I live this very privileged life of being able to run around the world and talk about my experience of having what some would call a serious mental illness, and being able to chat about it and work with people in healthcare settings, in workplaces. And we do a lot of stuff around developing peer support programs. So people in workplaces who have, common shared experiences, being able to chat with each other. So I'm really looking forward to the conversation about how we can just make it this conversation. Oh, I broke my leg today. Oh, I have a mental health issue. Just being able to kind of be in those spaces. So thanks for letting me come and play.
Okay, I like that. So just I think to kick things off, the one question that I do have across the board is, now that we have been hearing a lot more about struggling with mental health issues in the news and such since the onset of the pandemic. Are you seeing any changes in the way that mental health is talked about in the workplace? What sort of things are you noticing in your own work? I think Karma, maybe I'll just start with you again.
Sure. So I think that because, and Robyn, you spoke to this earlier, that the pandemic was really a shared global experience. And so those feelings of sadness and loneliness and uncertainty were more relatable, I think, because it impacted all of us to varying degrees. What we know to be true is that those who previously struggled with mental health issues, this was kind of magnified for them as well. So we have to, give some consideration to that. I think it's interesting that, therapists report that they have seen 50 times the number of clients that they had prior to the pandemic. And so what does that mean? What that means is that your family member, your friend, your colleague, those people are all accessing supports. And it's those kind of conversations and that normalizing that is moving the conversation more to, hey, I know someone that's doing this and taking care of their wellness, whether that means having a broken arm or checking in with a therapist to assist with health. So I do think that the stigma is lessened and the conversations are opening up.
Hassel, do you want to tell us what you've seen in your industry?
Yeah, absolutely. So I always like to joke that before the pandemic, I mean, there was already an epidemic of high rates of mental health and substance use challenges in hospitality. Anyone that knows restaurants and bars and hotels knows that that is synonymous with working in this industry, unfortunately, because just for some background, workplace mental health has been neglected for centuries in these industries. It's never been invested in, it's never been talked about. So we're playing catch up on a long, long time. But before the pandemic, even though the rates were really high, no one really wanted to hear it. We heard a lot of people telling us like, no, we're good, not us, good luck and all that kind of stuff. And I always joke that the pandemic kind of took us by the hand and moves us from the back of the line of the conversation to the front of the line and gave us, VIP status, because we can't keep up now with the amount of businesses and companies and employers that want our, help or guidance or, recommendations for resources, support, conversations, leadership training, all these kinds of things. So I've seen definitely, like Karma said, a decrease in stigma, but it is not massive, it is like, obviously as a nonprofit mental health organization, we've noticed it in a massive way, but I mean, in the workplace, it's actually not at least for these sectors that I'm speaking of, it's not a massive shift. It's definitely just an increase in awareness. So there's definitely some folks that before would never have even said these words in the workplace, like mental health or therapy or EAP or, any of this kind of stuff, they wouldn't have even been brought up or discussed. But now they're definitely starting to seep in. And because of, I'm sure many of you have heard of the quote unquote great resignation and the labor crisis that we're seeing across the world, really, but predominantly in our country, employers are having no choice but to have to address a lot of these topics in order to attract and retain talent, and now even add certain benefits, right, to your compensation package, which I think is also a sign of that stigma decreasing.
And Robyn, what have you been seeing as well?
I love the piece about, I think the stigma has decreased, but I think we still have a very long way to go. I think personally, well, and this is where, maybe I'm the outlier, like, I think mental health has become this sexy topic to talk about. Everyone's talking about it. Oh, we've got to do something in workplaces about mental health. And I think it's great that we're talking more about it. But I think sometimes we're missing the mark of checking in with the people who work in the environment about what do they see as some of the benefits that would help. And don't get me wrong, I love like the things that are occurring, like there's more conversations, people might be running more workshops, people might be looking at EAP and things like that and peer support programs. But I still think it's still kind of top-down approach rather than let's hear what the employees really want. And I think there's still many people very scared to talk about it. I think COVID brought out this discussion about depression and anxiety. It didn't bring out the discussion about, woohoo, I've got bipolar disorder, which I have, right? I'm open about that. Or I've got schizophrenia, or I've got this. So I think what we did was made some things more able to be talked about, but we still have people that were dealing with stuff from pre-pandemic and even getting like their diagnosis or whatever it is now. I think we're still missing the mark on being able to have conversations like that. So I'm super excited that we've stepped forward. I just think we need to have even different conversations. I had a chat with a few people yesterday, and they said, like, some people are like, oh yeah, I got through the pandemic, my anxiety's gone, so it's all good. But we've still got people who are dealing with their mental health every day who are nervous still to come forward. What's going to happen? Am I going to lose my job? Am I still going to be able to do this? Even when we've created like environments that we think are better to have those conversations.
Yeah, I'm wondering, like, just if we can spell it out, I'm sure that lots of people, what are some of those fears that might be coming up for people? Like, what is the perceived consequence? Maybe there's a real consequence, right? Like, so if we just, Hassel, if maybe you want to start with what a perceived consequence might be, or those fears.
So I think some of them are perceived and some of them are very real. So I remember the reason why I stopped talking about mental health in the workplace, this is pre-pandemic, is because I had a very real fear of getting fired. There was a time in a restaurant where I was talking about wanting to change my schedule so that I could, basically I was making a workplace accommodation request without knowing what that was at the time. I didn't have that vocabulary at that time. And I was asking for a change in schedule so that I could accommodate some appointments to address my mental health. And I was basically shown like a pile of resumes, being told that I was disposable and like, we don't have time for this. So get back to work. And constantly told to check I don't know if we can swear, check my emotions at the door, but that's not how they said it. And it's very real consequence. I knew that it wasn't normalized, these conversations. And even if it was normalized, I knew that my employers didn't have the actual, like they weren't equipped for being able to actually handle these conversations. So then it's just, you suffer in silence and you internalize things. And it's not just me, right? It was like abundantly everywhere. Kind of like right now, we are still living through a global trauma. There is still collective grief and no one is unaffected. So I would say, other than the consequence to my job, there was also a massive fear of the way I'd be perceived by my peers, by my colleagues, by my, people that I respected and cared about. And, maybe I wanted to impress some of them, or I wanted to, build other kinds of relationships with them. And I still hear that this is happening, still to this day. And so I think in some workplaces more than others, obviously, you can't just generalize everywhere, but I think sometimes we think that we're more accommodating and supportive than we actually are. And to Robyn's point earlier, I absolutely agree as well that there's a lot of conversation being put on individuals, like the leader or the employee, when in actuality, I do think the conversation needs to shift a little bit more to the systemic change.
Can I jump in, Sarah? I just want to
Jump on in, Karma.
I love what you said. And I think it's so true, because we all want to be successful or perceived as successful in our roles, regardless of what that role is. And I think it's this fear of being thought that we're not able to cope. You know, you're not coping. Would you please look at there? They can't cope. And to be truthful, it's even more compounded for individuals who are responsible for childcare as well. So, you know, what's wrong with you? You can't juggle your job and your role as childcare provider. So it is really a big fear of that labeling of not being able to cope and consequently then not being good at your job. So I 100% agree with you. And I think that is one of the biggest internal barriers that we put on ourselves is that fear of that label.
I love this conversation because it is the perceived and the ones that maybe aren't there, but we, or are there. Sorry. But it is that piece about, am I scared about losing my job? And there are industries that are very clear. And I love how you said that. Here's a pile of resumes. You really want to talk to me about, you want that half an hour shift change? I don't know about this. But you've also got the issue of, I know for me in the past, and I'm, talking to people that's still there, that when you come out and share that, depending on the culture in the workplace, if you're having a bad day and you're like, oh, I'm so grumpy today, people are like, are you getting manic? Are you getting depressed? And you're like, I had a normal emotion. It's not related to my mental health. So there's an amp up sometimes of, is that because you're crazy versus, oh, I had the same reaction as someone would if they were dealing with it. There's also the piece of sometimes people are treated with kid gloves. So it's like, I heard the example of an employee where the employer, like nothing malicious about this, just unhelpful, helpful, going, well, let me take this away from your job and take this away. And you were talking about, that piece about we think it might be too stressful or you're not coping. So then you treat it as this fragile person rather than a conversation about that. Or even when you come back to work, if you take time off, right? Sometimes there's this, like employers are great and they're like, yeah, let's work with you to work this out. And sometimes you're treated really differently. So you get one of two experiences often is, oh, we'll just throw you back in and you're good to go because you've been cleared to come back to work. Or the other one is, well, we have to be super careful with you. So someone wants to get back into work and get back and the employers are going, well, hang on. An example, a friend of mine came back to work after a significant time in a psych ward, ready to rock and roll, ready to go, amazing to get back there. And the employer was like, well, let's have an hour here. And this person was like, coming back to work is good for my mental health. So there's a whole range of those things that occur around that. And the gossip piece, if you're in a workplace that, I see yourself going, if you're in a place that gossips and you walk into a room and all of a sudden the room goes quiet, you're like, is that about me? And you mightn't have been paranoid before, but you might start to have a little bit of that. Are they talking about me?
So one of the things that we talked about is, one component of this change is a systems change, and another component, is maybe getting those supports into workplaces, and more workplaces are getting those supports in place. But how do we create cultures that encourage seeking out those supports, and coming forward with your mental health concerns? So how do we create cultures that where having mental health issues isn't stigmatized in the workplace? I'm wondering, what are some steps leaders, for instance, could take just to make their employees feel more comfortable with coming forward and saying, hey, yeah, I need help, I need a break. Who wants to start with that one? Karma, I guess I'm just doing the circle here, but Karma, let's go with you.
Well, I love this question because I view it like a health accommodation. So I think when we change the language that leaders use and HR uses, and just saying, what accommodations do you require so that I can support you in this role? And that can mean a variety of things, and leaders are welcome to give examples. So for example, perhaps you are non-normalized body size and you require adaptive workstations. Maybe you require a modified work schedule for a number of reasons. Perhaps you're someone living with a health condition that requires you to not work nights, for example. And I think that opening up that conversation and presenting it in that way makes it okay for the employee to say, thank you for saying that, and be a self-advocate, making that a safe space. I think it's also important too for leaders to start the conversation by acknowledging the things that they have found challenging, and saying, I am finding this really tricky, and sharing that and making it okay for people to say, yeah, me too, because then suddenly your manager feels that it's difficult. It's okay for you to share that you find it difficult too. So I think those are two really good starting points from my perspective, that managers, leaders, changing the focus as a good starting point.
Amazing. And Hassel, where might you start leaders off there?
I mean, I love those suggestions, Karma. I think those are so practical and so great to implement and incorporate right away. I think for me, a lot of it, like Karma said, is around language. I think it's so important to learn certain vocabulary, certain terms, and use them, define them so that everyone understands them in the same way, and then actually learn how to practice them. Because it's one thing to learn something, it's a very different thing to practice it. So I think, for example, the term psychological safety, is something that we're talking about right now. We're talking around, but we're not naming it. And, when someone feels like they can bring up something about their mental health or be vulnerable with each other, take a risk, make a mistake, and have no fear about the consequence that might have to their job or how they're perceived. That is a way to define psychological safety. So I think learning what that term is, using it regularly, sharing it with everyone. A lot of this can be with workplace mental health training. A lot of this can be through, other ways of learning. Everyone learns differently, but normalizing the learning of these things, learning about workplace accommodation, what is that? How do we define that? How does it work? What is the process? Let's use language like this. Also, as an employer, acknowledging that you have a duty to accommodate, and letting your employees know that, sharing this openly versus it just being something that one-on-one conversations with HR know about, but everyone else is left in the dark, because I see that happen a lot. So I think, learning how to foster psychological safety for yourself in your own workplace, because every workplace is its own ecosystem. Right? And my workplace is going to be different than yours. So finding a way to personalize that and customize it for you. Obviously, a restaurant's different than a corporate office job. So figuring out how are we going to foster psychological safety in our ecosystem? And then involving, like we said earlier, involving the team in that decision-making process. So gathering that input and, engaging with everyone and centering the voices of those most affected. Because oftentimes what happens is leaders, I'm a leader, and sometimes you get caught up in this like really bad misconception that we know better. And it's just not true. And then you get into really scary assumptions being made. A lot of times CEOs think they're doing more than their employees think they're actually doing. So I think that would be my recommendation.
I love everything you said, Hassel, right there.
You both stole everything I was going to say.
Yeah. So Robyn, I don't know if you want to build on that. I'm over here shaking my head, speaking on mute, agreeing.
I mean, I think one of the points, well, actually, I loved the points that both the other panelists made. I think one of the things when I think about that piece about listening to our employees, like sometimes we're not just going to be able to go out and go, oh, tell us what you think, because there is that nervousness. So, some organizations I know have done anonymous surveys. So we don't know who's saying what, but then we actually present all of the results and go, let's have a discussion about which ones we pick. Because if you've got, 1,000 employees, probably going to get 1,000 perspectives. But like being like authentic and going, here's all the conversations, let's work out for our workplace which ones might we try first, because we might try some things and go, they don't, let's look at something else as well. I saw something in the chat about how can leaders show empathy? And I think, if we think about that word empathy and we think about Brene Brown, like taking others' perspectives and staying out of judgment, for me means leaders actually hear what people are saying and don't go, oh, that's not how it is. Because I've been involved in places where, as Hassel was saying, people think they're doing a great job, but the employees are like, it's not hitting the mark. So taking someone else's perspective is being able to hear their viewpoint and how it comes across to them, and without judgment, being in a conversation, right? And hearing how they feel about it. And so sometimes it is that place about like doing some of the anonymous stuff because people are scared about if I step out and say, you're not helping me here by this. So I think there's places around that. I always talk about in any of the training we do, being passionately curious about what's happening for those people, the people who work for us or the people we're supporting, really wanting to get a handle on what it is for them and how it comes across to them. The other piece too is I think leaders hopefully really open to being respectfully challenged. Like I'm world renowned for these things called respectful challenges, where I'll poke and prod people who do training with us, respectfully challenge something, just wanting them to take a look a little differently, and they can take it on or not. But I always say, you can respectfully challenge anything I say. And if we can be in a space as leaders where we want to hear those respectful challenges, because if we're not hearing, I want to be honest, as a previous CEO of organizations, if I wasn't hearing complaints, there's one of two reasons. We're amazing. Nobody's that amazing, right? Or two, people are too scared. And so, like, how do we build that place? And that's why I always say I'm open for respectful challenges. I'm open to hear anything you want, and let's have a conversation. Because if we don't have that, like, we're screwed. We might as well go home now. Sorry.
The theme, I mean, I really love that respectful challenges piece of advice, and because the theme of this year's Mental Health Week is around the role that empathy can play in breaking stigma and such, what advice do you have for building empathetic workforces and increasing that empathy among leaders, among employees, with each other, just like that sense of patience and understanding? I don't know, Robyn, you gave some great tips, but Karma or Hassel, if you have any, either can jump in right now. Karma's going to jump in because I'm going to call her.
So I love that. And I also want to add, Robyn, I think too, to take the anonymous surveys to the next level, it's important for transparency that the company shares those anonymous findings, because it ties right in with your field and peer support, because then people say, someone else is feeling the same way that I'm feeling, even if it wasn't something they shared. So I love that. But I think that it's really important for everyone, not just leaders, to examine their values and really examine their bias and reset it if it needs to be reset. So reset expectations about always having to be on, and really model clear work-life boundaries, because we know that it does trickle down. And so how can people do that? Well, I love the out of office messaging that people are using now, where it says things like, I have a great example. It says, I'm currently out of the office, and thanks to insert company name, I'll say Inkblot. It's Inkblot's commitment to promoting work-life balance, I'm doing my best to unplug during this time. And so by leaders using those kind of messages, it makes it a safe space for everyone in the company to say, hey, I can acknowledge this too. I can take preventative actions to protect my health, and I can take the necessary actions to protect my health. So I think that's a good one. I think in line with transparency, one of the concerns that have come up during the pandemic is financial insecurity and job insecurity, and that's created a lot of anxieties for people. So I think it's really important from a corporate level for there to be transparency about financials, because that way everyone is on the same page, everyone is aware of what's happening, and it may help alleviate some of those concerns. So those are a few of my tips.
They're great tips. And Hassel, I wonder if you have something to offer. And honestly, this chat is so rich I'm distracted by the chat because we're getting such good pieces coming through here. I know that Jessica was mentioning that an important teaching from elders and others in Indigenous communities in the truth and reconciliation process is that truth must come before reconciliation. Leaders must be willing and able to hear the truth about mental health and their employees before anyone can address and reconcile breaking down stigma about mental health and making changes that are meaningful. That's a bit more on our discussion before, but for anyone who's doing the recording of this, I just want them to be able to experience that. And we have so much more coming through. We will do a question and answer in the last sort of 15 minutes or so of this. So if you want to start putting questions in the chat, that's highly encouraged. And Hassel, your advice on building empathy, let us know.
I mean, I love that you read that. I think that is so important. In terms of truth, I mean, that's something I'm constantly telling employers to acknowledge is, is particularly in the industry we focus on, hospitality and food service. I believe that all employers should be acknowledging the fact that they have neglected workplace mental health, because it's really important to hold that truth and hold space for that truth. And even when it's uncomfortable and painful, it helps people feel seen and heard, and, does create empathy, because, as an employer, you're trying to put yourself in the experience of your employees, and it's important to acknowledge that truth. One thing, it's funny you brought up Dr. Brene Brown, Robyn, earlier with empathy, because I've learned a lot from Brene in terms of empathy. And one of the biggest teachings that I walked away from that I'm really grateful for her kind of helping me get to this epiphany is the difference between empathy and compassion. And, you know, there's a saying of like, connect with empathy, but lead with compassion. And I think once you, again, going back to my vocabulary and language piece, learning what the difference is, what are the definitions of each of those terms? And I think with empathy, you know, you're feeling with the person, or you're trying to imagine what that person's going through. But with compassion, you're not just understanding what someone else is feeling, but you have a willingness to act to alleviate the suffering of another, which means she had this wonderful cartoon animated video I saw on YouTube once where there's like two animals and one of them falls down a hole. And she was showing how like empathy is the person who's still above ground looking down in the hole and going like, hi, oh, that looks terrible, you know, sorry that's happening to you. But compassion is the second animal coming down and sitting with the one that fell, you know, and just being there with them. Obviously, we're not here to solve anyone's problems or fix anything, but I think just being with someone in an experience and maybe connecting them to the help they need, or, you know, connecting them to resources or what have you, is a way to kind of lead with compassion. So for me, I think ideally you want both.
Rachel just made a really good point in the chat that sometimes the empathy needs to go both ways, and that the leader may be struggling at times and needs some grace from those they're working with. So making sure that leaders are equipped with, you know, the right support to do their job and take care of their mental health is equally important. Robyn, I don't know if you had any piece here, but we are getting close to the end of things. So actually, Robyn, if I can make you talk a little bit about the role that peer support could play in something like this. And if it's possible, because not everyone is going to be speaking the language of this mental health world, what is peer support?
So peer support in its purest sense is people who have some common experiences. They don't have to be the same, being able to share with each other. So for me, if I think about my mental health, like I have a diagnosis, some days I agree and some days I don't, and it doesn't matter. But like the piece is I get to have some conversations with other people who are maybe struggling at times with theirs. And, you know, I'll throw it out here. I have great conversations with people when they talk about they're feeling suicidal, because I myself in the past have attempted to kill myself, and I still have times where I feel that, and I can have a different conversation with people because I've experienced it. If we think about a really simple one, like AA, people talking together, or if you don't have those experiences, mothers and babies groups, mothers chat with other mothers who have had babies and they're like, the kid's screaming. Mum's like, oh, it might be this, it might be that. But in terms of workplaces, there's a couple of things for me. It doesn't necessarily have to be about, and this is me and our work, some other people are more purist, but people don't have to go, I'm suffering from a mental health issue. People might have gone through a divorce and it's ugly, or they may have had a death in their family, or they're stressed at work because of the work stress. I've done work with pilots in the past, right? And they're talking about the stress of being on the road and dealing with the, you know, the whole issues when another plane's gone down and the stress of that. And being able to talk to someone who's shared some of those commonalities is what peer support is. So we've been working in a range of different workplaces, supporting people to like develop a peer support program and train their peer supporters to be able to chat with each other. It's not counseling, it's not therapy, it's before that. right? People come in and, research shows when people have peer support, they're happier, they are less stressed. Some people don't even have to end up going to counselling and therapy because they felt heard and connected. And I had something really intelligent to say, and it just went.
You know what? I really think that when we had earlier in this discussion, we were talking about how each workplace is its own ecosystem and there's really specific challenges. So the role that peer support programs in workplaces, which I know this is offered also through Inkblot, probably through you as well, can play is really powerful because it is that shared bonding experience as well of having, okay, we speak the same language of this industry, this team, this workplace. So I do want to give.
Can I jump in and say one thing? My thought came back.
Yeah.
We talked about leaders, are dealing with their stuff, and then employees are. So what we've done in many workplaces is made sure we have peer supporters in every kind of designation. So if someone's a server and they want to talk to another server, they can. If they're managing like some kind of corporate entity, they can talk to someone who's got that experience, or they can cross-pollinate. But we try and have a range of jobs where we're, hopefully working with a long-term care home, and we'll have nurses and administrators and cleaners and like everyone, so that people can go wherever they want in terms of getting some support.
Mm-hmm. Did anyone have anything to add before I start looking at these questions? And I do want to encourage all of these attendees, which are almost 100. I'm sure you have questions for these speakers. So go ahead and put them in, or you can even put them in the Q&A chat and they'll come anonymously to me if you're a little shy.
And I just want to say, I love Robyn's work. I think it's invaluable in what it offers to people, because it's about building that resiliency. So one of the questions that we often will say to an individual when working with them is, what did you do previously that was successful? But taking peer support is almost like fast forwarding it, because you've had someone who found their way out of the woods, whether it's all of the things Robyn said, or dealing with a cancer diagnosis or anything, and they can shine a flashlight and say, here's what I did that worked for me. And so I love it because it really does help build resiliency.
So, I mean, Hassel, you were asked a question, which I think maybe, did you just answer, or you're answering it right now? I can't. What are some of the most common, this is very specific to your industry, but some of the most common and easiest changes you're seeing in the hospitality operations, like what easy changes are you seeing that are being successfully implemented to improve psychological safety in the hospitality industry? I'm sorry if that was really backwards. I didn't.
That's okay. I mean, this is a great question, and I would say this is for any industry. So I will say, because our hospitality and food service sector has neglected workplace mental health for so long, we are forced to look to other industries for, not reinventing the wheel, like what's already working in other industries, what really helps people across the board. And so I would say the fastest, most impactful ways that you can start to improve psychological safety right away is, a couple of things that we've already mentioned, involving the team and decision-making process. So gathering their input. I would say you can do that today, right? There's nothing stopping you. You can do anonymous surveys. You can start to have people submit their ideas different ways, however that looks like in your personal ecosystem. Another way we're seeing it really work quickly is addressing how inclusive a workplace is. Who is there, who is not there, who gets a voice, who doesn't get a voice. Really paying attention, to the diversity of thought, the diversity of people, to really address psychological safety. The more inclusive and diverse your workplace is, the more psychologically safe it will be, because you will be able to include different life experiences. We all have different things that make us who we are, right? Intersections that make us up. And so making sure that that is something you address right away, that can be done for free right away. You can do a self-audit. Another one is to examine, this is a big one, especially for hospitality, because we are impacted by the brigade system, similar to the military. We have a hierarchy, chain of command. So examining how mistakes are handled. Traditionally, they are penalized. And so it creates a very authoritative fear kind of work environment. And so instead, we always say, making sure that you're seeing mistakes as a learning opportunity. There's no way to progress, to be innovative, to be creative, if you're penalizing folks for making mistakes. It goes against everything that psychological safety is. And the last one, I'm like a broken record. The last one that I already said is the workplace mental health training to increase vocabulary, tools, and support skills.
I do think that vocabulary piece is really important, because if the employee doesn't know what you're talking about, for example, we encounter this with EAP. Lots of employees don't know what that is. Karma, I'm going to make you explain it probably at some point. Then what use is it? So another question that we got coming through is, how do you begin a conversation about your mental health in the workplace if you're with an employer who maybe doesn't see, if you feel like they don't see value in that mental health work-life balance? Is it, how do you start a hard conversation about your mental health with an employer when you're not maybe feeling super confident that things are safe? Anyone have any thoughts on that?
It's interesting, because I'm kind of one of those people that will just throw it out there. It's this weird dichotomy. We're damned if we do and damned if we don't. Because if every single person in the workplace stood up that has some kind of mental health issue, we would know that it is a lot more than 1 in 3. And if we stand up, at the moment, there's still the concern about stigma and discrimination. So one of the things I talk about, which is maybe a little bit out there, but I talk about what I've learned, what skills I've learned from dealing with my mental health that actually make me a better employee. And I talk, and in general, not specifically if I was going as an employee, but in general, if workplaces are a little bit hesitant, I have talked about the cost of what it costs to workplaces. Like, how many people have we lost, and what's the cost of recruitment? What's the cost of retraining? And so when I have conversations with employers, I'm like, I know you might spend a little money here, but actually potentially you save this much. And for some employers, that's what talks to them. And for some others, like, I talk about the cost of human, resource, not financial. So it just depends on the workplace. I've tried different tacks, but it is one of those things. We learn a lot dealing with our mental health, and those skills can be amazing in workplaces. So I've often encouraged people to talk about that. I talked with one guy once in a training, and he's like, who's going to give me a job? I've been in the justice system for 17 years. I said, what were you in for? He goes, I'm great at breaking in. I can't get out in time. And I looked at him and I said, well, what skills do you have? And he was like, God. And he walked out and he went to a security firm and he said, you actually need me. I can look for all of these things. And he talked about his mental health stuff as well. And he got this job and he got them talking about mental health. There's a company, Mod Pizza, in the US that only employ people with justice backgrounds, addiction, or mental health. because they see the loyalty of an employer taking like people who sometimes are like, well, we're not going to employ you because we're scared of what will happen. Those people have like this loyalty of employees because they've gone, we're gonna like go with you and look after you and support you. That's huge. Sometimes we can't give people more money, but like that stuff buys more than sometimes money does. Not always. I want to be clear. We have pretty low wages in many sectors, but yeah, anyway.
Karma, I'm wondering if you have any advice on beginning that conversation, or maybe whether you would advise that somebody go to a mental health professional first for training on how to have that conversation. Like, because of your experience with workplace mental health, like constantly, you may be really often talking to people who are coming to you with these issues. So,
well, I am always going to encourage people to talk to mental health professionals, just like I encourage people to talk to their doctors. To me, they're one and the same. So I would always encourage someone to see their physician if they have a concern that is medically related, and I encourage people to talk to a counselor or mental health professional if they have concerns that can be alleviated in that area. I think that it's really important in this, and you've heard me say this before, because I'm a big proponent of self-advocacy, and although it's difficult and it takes a lot of courage to be an advocate in any area, I think it's important for individuals to feel empowered to go to their employer and say, there are some accommodations that I need that will help me be a better employee. Because one of the things may be that the employer just simply isn't aware that this is something that you need. And then have that conversation, a reasonable give and take conversation on what can be accommodated to help you feel supported and safe. And I think it's also important for employees to use that language to say, I'm not feeling supported and I'm not feeling safe, and really be a self-advocate.
We're hitting our time. So I wonder if there are any like last encouraging words around breaking stigma around mental health in the workplace, just anything, either like a last piece of advice you have for leaders, or just like a vision of what you want to see. Like, what do you all want to see in this future workplace where there isn't stigma around mental health and people always feel psychologically safe? What changes do we want? Hassel, I'm sure you've got that vision fleshed out. I know you do.
Yeah, I mean, it's so layered and complex, right? This is not, I guess I would really just love to see this kind of conversation and these kinds of points that we're covering today just be, said and done and heard over and over and over again. Because what I see happen so often with mental health, which is so similar to like DEI or like other topics that are really hard and complex and layered, that they just, touch on once a year. And it's like, check, it's mental health week, check, it's mental health month, check, it's let's cover it in a workshop once a year. And the reality is that turnover rate is high. So the cost of turnover affects you. And if you only do it once a year, your staff that may not be there in 6 months miss out. So I would say that this needs to be part of your business model. It needs to be built into the DNA of your business. And like Robyn mentioned, there's a massive return on investment for investing in these kinds of resources and support. So, someone asked a question I saw in the Q&A about like, what do you do with employers that aren't converted already, that aren't like convinced? I would say you present the business case. The World Health Organization has shown there's research that supports this. Deloitte did a study here in Canada 2 years ago that shows the ROI of workplace mental health investments. And the other last piece is a really exciting research. Well, exciting depends on who you are. I nerd out on this stuff, so I find it exciting. But there's some research that came out really recently about what defines a toxic workplace. And if you Google that study, it was presented in the MIT Sloan magazine, and it's incredible because it shows that toxic culture is 10 times more powerful than compensation in predicting a company's attrition rate compared to its industry. And so what does this have to do with mental health? Well, when you have a toxic workplace, it impacts everyone's mental health. It impacts your turnover rate and impacts the cost of, this is money that's not going to be shown on your budget, but this is money that's leaving your business every year. So you're hemorrhaging money and you're like, isn't our profits bigger? And it's all interconnected. So I would say, look into the business study, have these conversations regularly. If you don't know how, reach out to me, not 9 to 5, send me an email. I will present your whole thing for you because I've had to convert people and have these discussions, as Robyn said earlier, respectful, thoughtful disagreements with folks that don't see it this way yet. So yeah, I would say that it requires everyone also. So if you're listening right now, you play a role in making this change. It's not all on you, but you do play a role.
I feel like that's a really good place to end when we're running over, even though I want words from everyone. One of the things that I will do, this is going to be a recorded session. It will be shared with everyone who registered. I can also share some of these resources and studies that our speakers were really excited about. We can include in that email. And yeah, Robyn, if you were brewing on something, we still have some folks here if you want to add in, but we'll sign off shortly.
Come and play with me and peer support. Woo!
Karma, do you want to say, don't be afraid of your EAP. It's called an employee assistance program.
Well, and of course, Inkblot is really changing the landscape because we allow individuals to continue engagement with their counselor once that therapeutic relationship is established. So you can make very meaningful changes to the things that you're faced with, and it becomes a lifelong success story for you because you continue working with the counselors. That's one of the things that sets Inkblot apart for an EAP, because we really believe in continuity of care.
I saw that in the chat, actually, somebody discussing that with their care. So I want to thank everyone for coming today to have this conversation, which hopefully continues throughout the whole year in your workplace. And you'll see an email from us with more exciting updates and resources in this session. And thank you, Hassel. Yeah. All right, everyone, enjoy your afternoon. Take care of yourself. Enjoy your life. Take rest. And we'll see you next time.
Bye, everyone. Thank you.